Hello, hello, hello. Assalamu alaikum. Jianu, Pakhaira Galeni, Hamachu, Reshume, Washmale, Hi, Gonzaimus. Hi, hugs and hellos to all those beautiful, amazing people who are tuned into PTV World and PTV Global at the same time. My name is Shahzad Khan, and with me I have the very beautiful Maha Makhdoom, and you guys are watching World This Morning.
Yes, and someone is really awake this morning. Assalamu alaikum, Shahzad.
Walaikum assalam.
And today we have an informative show for our guests. As you know, that we have to look after ourselves, we have to look after our health, and we've done loads of shows on different health features, like for example.
For example, we can talk about kidneys, we have been talking about hearts, we have been talking about different bone diseases, we have been talking about different type of cancers, and we have been trying to make you aware of all those epidemics which have been within there,
Yes.
within our society. But then at the same time, ladies and gentlemen, it's very famously said that the only best curve which a body has is the smile.
Yes, absolutely.
Come on.
Okay,
smile.
and for that, we need to look after that. And also, we have to go to the right people, we have to have the right information. And within Pakistan, as we know, there's a lot of quackery around, there's a lot of misinformation, there's a lot of people, a lot of professionals misguiding their patients. So today,
Exactly.
we've taken it on as our responsibility to give you some information on the situation of the dental health
Hygiene, dental
profession.
health, and what are the different specializations which are there within Pakistan,
Yes.
within the field of dentistry. And then, just because of the fact that she said that there's quite a lot of quackery, but yes, other than doctors, there are people who cannot even afford to go to a dentist. So they
Exactly.
probably go to people who are sitting probably by the railroads or probably on the roads. So what type of hygiene do they have? Do they even have any concept of hygiene? We'll talk about all of this, but then we'll figure out which other field specializations are there under the branch of dentistry.
Exactly, so that we can actually guide you guys properly. So to discuss this and to represent the different areas, we have been joined by Dr. Saima Aleem. She is a dental surgeon. Assalamu alaikum, good morning. Welcome back.
Thank you so much. Thanks for having us on the show.
Thank you very
It's
much
a very
for coming
important
over.
topic. I mean, your mouth and that's what you eat, that's how you live. So, okay, now besides Dr.
So what
Saima,
is
it's
it?
very early today, guys. So Shahzad is going to be leading the show today.
all
But
right.
besides Dr. Saima Aleem, we've been joined by Dr. Laiba Seher. She is a resident and master's in dental surgery right now. Assalamu alaikum, good morning. And she will be talking to us about implants and focusing on that. Besides Dr. Laiba Seher, we've been joined by Dr. Iraj Shuja. She is a consultant and an oral maxillofacial surgeon.
Surgeon.
Yes, she does surgery.
That's the
Assalamu alaikum,
field.
good morning.
Walaikum assalam.
How are you?
I'm fine.
Thank you very much, ladies, for coming over. So I think we'll start the conversation with you, Dr. Iraj. What is maxillofacial surgery?
Okay, I'll explain in simple words basically.
Go ahead.
And people, whenever they go to a dentist, they think that dentistry is the only branch, okay? There's no specialization.
Yeah.
But it is basically a speciality of dentistry. Like if your child is having some problem, you'll go to a pediatrician.
Yeah.
And if you have some GIT or stomach problem, you'll go to a gastroenterologist, right? So if there is any problem with the facial skeleton, with the soft tissue, with the hard tissue, with the oral cavity, any kind of pathology, any kind of trauma, any kind of congenital problems like cleft lip or palate, then that patient is supposed to be managed by the maxillofacial surgeon.
Okay.
Okay, so this is basically a subspecialty of dentistry.
No, but is it a subspecialty of dentistry or cosmetic surgery?
You can say it is,
I'm confused.
no, it is basically a subspecialty of dentistry, but cosmetic surgery and aesthetics is very closely related to it.
Okay.
Because the function of the oral cavity, the occlusion of the oral cavity, the aesthetics of the oral cavity is better understood by a maxillofacial surgeon.
Okay.
Because a dentist is constantly learning about face, neck, and the cosmetics. I
No,
thought you were-
no. We figure out who's going to ask the next question.
Okay, sorry, I
Don't
thought
worry. No, don't get me. Okay, now that's oral maxillofacial surgery. Now, what is the difference between that and a dental surgeon? Or is there any difference?
it is basically different. Like dental surgeon is basically a qualification you achieve after doing your BDS or 4 years of graduation.
Yeah.
Then you have to do your specialization, like be it MCPS or FCPS. Like if you are going for MCPS, you have to do 2 years post-grad training.
Right.
For FCPS, you have to do 4 years post-grad training.
Right.
Then apart from these two, we have MDS, which is also a superior degree, and in which you have to do 4 years training. Then we have MPH, like what I am doing, that is an MPhil, and you are related to public health. So you have lots of options after doing your BDS. So BDS gives you designation of general dental surgeon, but after your specialization, you get designation of consultants or
Okay, so if I had, some problems with my teeth, so at what point, when would I go to a dental surgeon, or when would I figure out that I need to find someone who's specialized? Or would the dental surgeon tell me which specialist to go to?
No, they won't. They'll be like, we can treat you. They'll be like, we can treat
like
you.
if you come to a general dentist, general dentist has all the domains to cover, be it your operative dentistry, your prosthetics, your general surgery, minor procedures, not the extensive one, okay?
Yeah.
So whenever you walk to a dental surgery, you have to meet a general dentist in advance, okay? So general dentist is basically there to give you initial treatment. But if you have to go for detailed procedure, like for any, for that matter, any cosmetic treatment, or you have to do your bone grafting, you have to get your implants. So for that, you have to consult a consultant.
Right.
Because that is the domain of a consultant or a specialist. But for general procedures, be it your root canal, be it your filling, general extractions or something like that, you have to consult general dentist.
Okay, that's cool. So let's talk about you. What have you picked up on? What specialization are you moving on with? Because you're moving on with some I don't know what.
Post-grad stuff, fancy stuff. Okay, I'm doing my MDS, Masters in Oral and Maxillofacial Surgery. It's again surgery, but it's Masters, so I'm in it.
Masters in Oral?
And Maxillofacial Surgery.
And Maxillofacial Surgery. So you've got a competitor over here, right?
I'm a fellow,
Yeah.
and she's doing her masters. I've done my FCBS from College of Physicians and Surgeons, and basically the
So what's the
authority is
difference?
different.
Yeah.
Okay.
The authority is different, and secondly, internationally it could be considered, FCPS is considered as a clinical degree, Masters is considered as a teaching degree or more towards
So
an
did you
academic.
have to go through the BDS course, or you had to
Yes,
do
I have done my BDS, then I've done my house job, then I've done my 4 years of training, and I've cleared my part 2 exam and part 1 exam.
Brilliant,
It's
that
a
is.
long journey.
So
Okay, now,
initially, we all have to do BDS.
Yeah.
Okay.
Yes.
That is our initial degree. Then after BDS, we have to choose which way we want to go.
Okay, but
actually.
if a dental surgeon can pretty much cover each and every aspect of your oral health and hygiene, why do you think that there's a need to pick up on specialities?
Things are getting advanced day by day. Like you cannot cover all the domain. Like if I am a general dental surgeon, I cannot have the grip or grasp over general dentistry, specialized dentistry, or I cannot go for the details procedure.
it's like a GP, general physician, cannot become a psychiatrist.
But a general physician cannot go for a cardiac surgery. So same is the case in dentistry. Like if I am a general dental surgeon, I am not allowed, or I cannot go beyond my general dentistry domain.
Okay, great. And now that we have established the difference between the specializations and a general
We need a
practitioner of, we're going to go for a short break, and I'm going to get my language all right and the terminology correct. So we're going for a short break. Stay tuned. It's very interesting.
Good morning.
The Festival of Lamps, or Mela Chiraga, is a very important and popular event in Pakistan. This is celebrated every spring on the last Friday of March outside the Shalimar Gardens. The show has been described as an eloquent expression of Pakistan's heritage and an authentic account of its agricultural and industrial achievements.
नमन बेहुदा गिरदे नमन बेहुदा गिरदे पूछाओ बाजार में गर्दन.
The Fortress Stadium, the venue of the show, is thronged by active participants, foreign visitors, and people who watch the festival with great enthusiasm, verve, and aplomb. A large number of them are interested in watching and appreciating the best breeds of livestock. Many derive pleasure by watching other activities, such as the display parade of animals, dances by horses and camels, polo matches, tent pegging, dog shows and their races, daring acts of stuntmen, mass display of military band, rhythmical physical exercise by children, tastefully decorated industrial floats and torchlight tattoo shows.
बेहुदा गिरदे
Additional attractions include a subtle interplay of lights to weave enticing patterns at night and breathtaking acts by foreign groups. Fairs and festivals of Pakistan.
Alright, ladies and gentlemen, welcome back. You guys are obviously tuned into PT World and PTV Global are watching World this morning alongside Shahzad and Maha, and today we have had dentist. Within the branch of dentistry, there are different specializations and each one of them belong to different specializations. That's what we were discussing before the break, but now let's dig into it. So I think I'll ask my
take it
first
away.
question from Dr. Saima. And Dr. Saima, what is the difference between a bridge and a partial denture?
A partial denture is there, the thing which you can remove actually, which the patient can remove at night and then they can put it in their mouth in the morning. The bridge is basically a fixed prosthesis that is there for in your mouth for whole lifetime. Then for the bridge you have to get the support from the abutment teeth, the adjacent teeth. The bridge is there basically to give you an aesthetic as well as to replace your missing tooth. And that is for permanent reason. And bridge can be made on implants or without implants, like depending upon the scenario. But a partial denture is there to fit in your mouth with the help of clasp or the wire. So that is for permanent restoration.
And
so
the wire can be visible.
Wire can be visible, and most of the time it is visible. But partial denture is basically provided to the older patients, like which have the old ages, then they don't have the support or they don't have the fixed teeth in their mouth. The bridge is there for the young. We recommend them to young patients, plus that is a fixed replacement.
Okay, but picking up on denture, sorry, I just wanted to dig in a bit more deeper. That is that, for example, if somebody has lost like 2 or 3 teeth, that means that they can get this partial denture.
They can get this partial denture, but we recommend the younger patient to get bridge instead of this partial denture.
Why do you recommend this to the younger people and why do you recommend the partial denture to the older people?
See, what happens is that in the young age, you don't have the habit of putting the denture in your mouth and then you have to take it out again and again. Plus, it is sometimes having the problem of retention. Like whenever you are talking, it might have retention problem. It can come out or dislodge from the cavity.
Like
so that is quite embarrassing for young people.
Why are you cracking a joke?
Exactly. It can happen. So that is why we actually recommend the fixed prosthesis or bridge to younger patient so that they don't have these issues. Plus the bridge is there for a reason. Bridge is there to provide a support for a longer time.
Okay, great. Now that leads perfectly to Dr. Laiba's question. So in regards to dental implants, where does this all fall into it? This is when someone is considering getting implants?
Okay, dental implants are considered more superior because the patient cannot remove them or not has to remove them. So it leads to more patient's comfort and more mental satisfaction. Like they are talking in an occasion, the dental won't pop out. So the implant stays in the place, it feels, fits and functions like a normal natural tooth. So
Okay.
it's very comfortable for the patient as well.
Okay, now at what point does one need to, come to you to see if they need an implant or not? Because, is it when the tooth needs to be removed or is it rotting? Like, at what point?
I think when they're going to meet their in-laws.
See, whenever there's a missing tooth, you need to replace it because you have to eat something at the end of the day. You can start with soft bite, but eventually you'll have to bite on the harder things. So you need a good tooth in your mouth.
Right.
So for that, you can replace it with a crown or a bridge or an implant.
Okay.
Why would I recommend an implant? Is that it's a better option because it leads to more satisfaction of the patient, as I told earlier. Secondly, it behaves like a natural tooth, okay? Inside the bone also. It sort of stimulates and stabilizes the bone along the way.
Okay.
So, and the patient has very ease of cleaning and all the oral hygiene maintenance things with the implant. So it's a better option regarding all of these aspects.
Very nice.
Okay, great.
And that will definitely lead us to Dr. Raj over here. Now, for example, if somebody has got, that surgery done, now do you think that they can still go on with the same toothbrushes which they have been using as well or not? Or, is there a different treatment for that?
I would like to add something in the
Sure,
implants
sure,
as well. The most important thing to get an implant done is first to be referred to a proper surgeon. Okay, everyone cannot do implants, right? Secondly, it's the most important thing is patient selection criteria, right? A person just out of the blue just cannot say, okay, I want to get an implant and just go and get an implant. Okay, so if the patient is having some medical condition, or if a patient is a chain smoker, or if the patient is having periodontitis or not having a proper oral hygiene, they are not proper candidates, they are not good candidates for implant.
Okay.
Because if you are spending so much money on a single implant and it is
It's
failing,
expensive then.
yeah, yes, it's quite expensive.
Okay.
And you are basically, there is a surgery, you have to get the implant, it has to osseointegrate in 3 to 6 months, and then you have to get a crown on it or a restoration on it, and after all the pain, it ends up failing.
Okay.
So patient selection is of utmost importance during implant placement.
Okay, so I hope everyone listened to that. So you need to know all the different tick boxes that you need to tick before you consider
Yes.
having an implant. Otherwise, you're wasting your money.
Exactly.
Okay.
Okay.
But then at the same time, since you specialize in maxillofacial surgery as well, so I have seen kids who born with some
Yes.
abnormalities at the philtrum as well, right?
Yes.
So can you treat that too?
Yes.
It's cleft palate,
Yes,
right?
it's called cleft
Known as
lip and
filter.
palate syndrome. Yes, cleft lip and palate syndrome. Okay. Apparently, when you see the patient, you just see there's a gap in the lip.
Yeah.
But mostly the gap is extending to the alveolus and to the palate as well, posteriorly. Okay.
I didn't get it. Obviously, I can't get it.
It's going
Make it a bit more
posteriorly.
simple.
Yeah.
Make it a bit more simple.
You have to use layman terms
Yeah.
now.
Okay.
So start again.
Okay.
What is a palate?
What is a palate?
Yeah.
It's basically upper jaw.
Okay.
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 Just say upper jaw.
Okay. So cleft lip and palate patients are basically having a gap in the lip and in the upper jaw.
Okay.
And in the dental part as well.
Okay.
Okay. The thing with the cleft lip and palate patients and their treatment is that many specialities, the treatment is overlapping with many specialities. Okay. A plastic surgeon would say that they can repair a cleft lip better than a maxillofacial surgeon.
Yeah.
Okay. But the problem comes when the cleft lip or the gap in the lip is bilateral. Okay. When it's bilateral, this part of your face, it's protruding.
Okay, so what we're
Yeah.
going to do is we're going to try and get some images to show
I can
our
make a
viewers.
face like
no,
that.
No, don't do it. Don't do that. That's not right.
something like that.
No. Let's get some images.
right?
So we'll show them to our viewers. Yep.
So we call this part the premaxilla. Okay. When the premaxilla is protruded, the problem is that surgery cannot be done.
Okay.
You cannot re-approximate the lip because the gap is too much
Okay.
to handle. Okay. For
Okay, we're
that-
really going to get some videos for our
Yes.
viewers so
Yeah.
that we
Yes.
can explain this. Yep.
So before the repair, you have to mold this segment, and you have to bring it back.
So basically,
Yes.
It's a job of a specialized
Yes. So,
dentist.
yes, exactly. An orthodontist is involved in the treatment, okay? A maxillofacial surgeon has to be involved in the treatment. A plastic surgeon has to be involved in the treatment. A pediatrician has to be involved in the treatment because patients of cleft lip and palate, they have other abnormalities as well.
All
Okay.
right. But
Like hard
can we move the
abnormalities
jaw forward or, you know,
Yes.
a bit to the back?
Yes, that is another field, okay? That is orthognathic surgery. For example, if a patient comes and says that my upper jaw is too much protruded,
Okay.
or my chin is too much protruded,
Yeah.
okay?
Or my face is too big.
Too big, too
Jaws.
small,
Too small, it can be anyway.
yes,
Yeah.
yes, asymmetric or whatever, then it comes under orthognathic surgery, okay? In that field as well, you have to consult an orthodontist, you have to consult a maxillofacial surgeon, and then get the surgery done. It's an extensive field, okay?
Okay, and thank you so much. That's really informative. And so anyone who has a child who has this, cleft palate or a cleft lip, they need to go through these stages.
Yes, I
Okay,
will.
now coming back to Dr. Saima, in regards to well, we're talking about when you get the implant, and then we've moved on to the surgery aspect. of it.
Post-surgery aspect.
The
I think.
post-surgery.
Yeah.
So once you've had these implants or you've had this procedure done, what is the way to look after yourself? Like
Look after,
yeah,
like we have.
obviously oral hygiene. That's why you guys are here.
Yes, after getting any implant
Yeah.
or let's say any prosthesis or any replacement surgery, you have to be very vigilant about your oral hygiene.
Okay.
Like if you are having a brushing routine once a day, you have to change it to or bring it to twice or thrice a day even.
Right,
Like initially, for initial some time. And I think Dr. Iraj and Dr. Laiba can better guide about this, because you have to see that if you are not maintaining a good oral hygiene, you can take your implant towards a failure. And the failure is very much related to your poor oral hygiene.
Okay, so Dr. Leiber, tell us for an implant, what is the hygiene routine?
And before you tell us about that, who can get an implant? Can everybody get an implant?
No, there is a patient criteria. You have to choose the patient prior to telling them you can get implant or you cannot get implant.
Okay.
The first factor which is important is age of the patient. You cannot give implant in a growing child. Okay? You need to give an implant.
What do you mean by a growing child? Like I'm a growing child now?
No.
No, you're not a child, you're an
Well,
adult
I'm just
now.
18.
You need to give implants
gosh.
to at least an adult, okay, who's growing right now.
So at least 18,
At least
20 years
18,
old.
yes. Post-pubertal period. The patient who's out of their growth spurt time.
Okay.
But why? Tell us the reason too.
Because you're growing.
You're growing, the implant won't stay in the place that I placed it previously.
Okay.
The bone would move, implant would move, the whole anatomy of the face would be
But
distorted
don't
because
we
of
have
that.
some amazing glue or something?
No, we don't have
It's just there
glue
to
like
hold
that.
it.
Listen, if you're 14 and you get an implant, your rest of your face is going to grow, and that implant is going to get all messed
And
up.
that is going to dislodge actually.
Yes.
That is
Yeah.
not going to
Common
stay there.
sense.
And your
Yes.
face might look like
Exactly.
It can also disturb the nerves and stuff. So,
Okay.
yeah.
Okay.
So that's one thing. So
One
the age
thing,
of the patient.
Age of the patient.
No.
But the good news is we can give implants in elderly healthy patients. That's a good news. That's a plus point.
Okay.
And second is the general health
orally
status.
healthy. or-
Orally, no, oral and
generally
systemic
healthy.
health. All of
Awesome,
that. It's
okay.
all of it, yeah. And the next thing is general health status of the patient. We need to make sure the patient does not have any active bone disease, the patient is not diabetic, the patient is not handicapped, he can maintain the oral hygiene, all these things. The patient is not smoker. All these things we need to take in consideration.
So smokers
because-
cannot get an implant?
No, they can.
Yeah, that's
they
what,
can, but
Dr.
they
is
need to maintain the.
It's a relative contraindication,
Yeah,
okay?
it's a relative
If
I'm worried now.
if they can quit smoking, then why not?
Okay.
They can get one.
can.
If they
Okay,
And
so
even
now,
if they can maintain a
They
good
can
oral
do oral hygiene
hygiene, they
afterwards,
can
they can
get.
get one.
But you
Yeah.
have to adjust your smoking habit to that.
okay, so
People
you
do that.
Okay, so we know now the requirements for getting an implant. Now, what about the hygiene factor? How do we look after an implant?
The first thing is brushing and flossing and using a good mouthwash. What people do not know is they brush their teeth in the morning and they don't brush their teeth at night at all. We need to tell them and teach them the proper brushing techniques, the way they need to brush their teeth.
Like this
Yeah.
or something,
yeah,
right?
it's a proper method, yeah.
And
that
then
can
like
be
this,
taught
yeah, my
easily.
cousin-
And then
the
you don't have to
dentist.
rinse your mouth as well, guys. Please remember that.
Right,
Let
after
the
After using
toothpaste
the
be in it.
mouthwash, you don't have to rinse
Yeah.
your mouth because we want the effect of that to stay a bit longer.
Okay,
Yeah.
so wait,
I'm
so
half a
okay,
dentist.
so apart from that, so you have to brush your teeth at night as well, and then what else?
in the morning after breakfast.
After breakfast.
After
okay.
breakfast, not
That's
before
the-
the breakfast.
That's the hugest mistake everyone makes. Matlab,
Everybody makes.
everyone before breakfast they brush their teeth, okay?
Yeah.
But you
And
don't feel like, brushing after the breakfast. You like, oh my God, I cannot
But
have
everything
breakfast.
that
can
you have
brush
eaten is
initially
just
after
brush
getting
your
up.
teeth all day.
Sorry, one at a time. Sorry, what?
After breakfast, you have to do this brushing technique, because whatever you are eating is going to be stuck in your mouth for the whole day.
And if you got an implant, you spend so much money.
Yes.
Yeah. Okay.
You don't want to ruin your money in the end.
Okay, so then, so apart from brushing and flossing and mouthwash, okay, now mouthwash. Now, this is something that a lot of people get confused on. Now, which mouthwash is the best one to use? I'm so confused.
Yeah.
I'm not going to take
Especially
any
when
brand
you live
names.
in a country where alcohol is banned.
Yeah.
Yeah, so you know.
Formula.
Actually, nowadays we have alcohol-free mouthwashes as well, so you can easily use them. And the mistake people make is they mix water with the mouthwash, then they use the mouthwash, and they rinse with clean water.
Was
in
it
the end.
too stingy?
This
man?
is no, they have good flavor to them.
Yeah. They're supposed to sting. That means that you've got bacteria in your mouth and it's killing it.
So the basic thing is you don't have to add water in that, and you don't need to rinse your mouth after doing the mouthwash.
Okay.
Because we want the effect to last for a good 2-3 hours at least.
Okay.
So that's the thing which people don't understand.
Okay.
Okay, but before we move on to Dr. Riddle, I just want to come back to Dr. Saima over here. Now, a lot of people, you know, when they have like a very weak teeth or a tooth, you know, what happens is that you go to a dentist and then they'll be like that, okay, we'll have to do a root canal, and then after a root canal, we will put a crown on it. Do you think that every time we have to go through that root canal just because of the fact that we need a crown on our tooth?
See, this is another misconception basically, that you don't need to get a root canal for every crown.
Oh.
Like there are situations where you have
See,
to
they have
get,
been ripping money.
Like that is a basic misconception, and this is a common practice in Pakistan, that every patient that is walking to a dentistry or dental surgery, the dentist is telling them you have to get a root canal so as to get a crown.
Okay.
So this is not the case. Like root canal is indicated in the situations where you have pulpitis, be it reversible or irreversible, you have some swellings, or you are getting inflammation. Like in that case, you have to get your root canal. And then after root canal, a crown is indicated. But in order to get a crown so as to cover the fractured part, or for any reason if crown is indicated, you can get it on a healthy vital tooth. You don't have to go for a root canal for every crown.
Okay, if somebody got a root canal but never got the crown, okay, so after a year they realize that, you know, I might have, you know, done it. Do you think that they'll require a root canal again then?
No,
just to get the crown?
No, no, it's not like that. If you have got root canal once and that is a proper 100% perfect root canal, you don't have to go for a root canal again. It is there for your lifetime.
I feel like Shazad's going to go to the dentist after the show.
But just because you've got such big muscles, man, you're brushing it like, I don't know, anything. It's just, I think that it's coming out.
But you know,
too.
after root canal, your teeth is more liable or prone to vitality, like brittle. It is going to be a brittle.
Oh, no.
So after root canal, that is indicated and that is recommended to get a crown. So if you are not getting your crown at the end of like many years, or you can say many months, you are going to damage your tooth. So it's better
and
to
then
get...
we'll have to go to Dr. Laiba
Exactly,
for an implant.
for an implant.
And Dr. Laiba will charge quite a lot of money.
Yes, I will.
Is he saying yes, I will?
So we will guide you to other
Highly
people. No, I'm kidding.
professional.
That's good.
Okay, but now let's just move on to Dr. Riz.
Yes, absolutely. No, we were talking about the hygiene factor and we talked about the root canals. Now, but I wanted to just finish off on the cleft lip and palate. Once someone has come to you, once they've gone through all the procedure, what is the routine for someone who's that? Because normally it'll be probably a young child because the parents probably will be getting them operated. How should the parents look after them? Because I guess the information here probably isn't that useful.
The first thing that has to be a message that has to get through to the parents is that first we have to counsel the parents, okay? Because the patient of cleft lip and palate has to go through multiple surgeries throughout their life.
Oh gosh, okay.
Which is starting from 10 weeks and it can last up to 18 years of age of that patient, okay? For the most important thing is the counseling of the patient,
Okay.
okay? And the counseling of the parents, okay?
Right.
Then there is feeding regime, okay? Because there's a gap between upper jaw, so your nasal cavity and your oral cavity is in communication.
Yeah.
Okay. So whatever the child eats, it would go into the nose.
Yeah.
Yeah.
It would
And
come
we're-
out of the nose.
Yeah,
basically.
yeah, I've seen that.
Okay. It can cause respiratory problems. Okay. It can cause oral hygiene problems, a lot of problems. So first is counseling. Secondly, after these multiple surgeries, patient have to take care of the oral hygiene, meticulous oral care hygiene procedures. Okay. That is all this brushing techniques, oral hygiene techniques, mouth washes, flossing, and they have to have a regular follow-up with an oral maxillofacial surgeon and with an orthodontist.
So
as
how
well.
regular is regular?
6 monthly.
Every single, and it's
Yes.
when it's a baby, how regular?
when the baby is born, initially he or she is counseled by the pediatrician,
Right.
first of all, okay. Then the patient is then referred to a maxillofacial surgeon.
Right.
The orthopedic appliance is applied with orthodontics.
Okay.
Then the patient goes for surgery for lip repair. Then when the patient is 8 years old, they go for alveolar bone grafting procedures, okay. After that, when they are older, they go for orthognathic procedures. Like these patients would not have normal growth of the upper jaw or of the lower jaw.
So
relatively.
so they have to maintain it
Yes.
and be on
So
vigilant.
at the end, at 18 years of age or at the end of maturity of age, they have to go for orthognathic procedures as well.
Okay, but
Okay,
very
interesting.
quickly before we move on to our break, and that what I wanted to ask was that quite a lot of times I've seen that babies, when initially they have their milk teeth, they're growing, and just because of the fact that they've got pacifiers in their mouth all day long, or they probably have a habit of sucking their thumbs or fingers, they just ruin the shape of their entire face.
I used to suck my thumb till I was 8 years old.
Where's
Me
your thumb?
Yeah.
All right. So, how do you think that we can probably avoid that, first of all? And then, for God forbid, if something of that sort has happened, because, there's a displacement within the jaw as well, who to consult?
Okay. First thing is that if there is this habit of taking milk at night, and if the kid is having the bottle in his or her mouth all night long,
Yes.
this is the most terrible thing that you can do to a kid. Okay. Because all night long the milk is within the mouth and it is causing caries, it is causing destruction within the oral cavity.
Okay.
First, this practice has to be stopped.
Right.
Okay? They have to, rather than giving milk all night long, give milk in intervals.
Okay.
Okay.
So give them some milk and then some water to wash away the
Wash
milk.
it off and then again give milk.
Okay, interesting. And actually, this is something that was said last time, and it's been said every time we've had dentists on the show. So, this is actually, I think, correct information.
Yeah.
But now we're going to go for a short break, and when you come back, we're going to talk about a little bit more about
We'll talk about oral cancers
the milk
as
teeth,
well.
Yeah, oral cancers, milk teeth, because some parents allow their kids to just let their teeth rot, and that's terrible. So let's go for a break, and when you come back, we'll discuss all these things.
Good morning.
Stay tuned.
You're doing.
Welcome back, everyone. And before the break, we were discussing the different specialities within dentistry. We're talking about looking after your hygiene once you've had an implant, if you've had a procedure to correct your cleft lip or the palate. But now, and then we also were talking about the baby teeth,
Yes.
the milk teeth, and how we were saying how mothers put their babies to bed and they let them sleep with the milk bottle in their mouth, but that's not good for their hygiene.
That's horrendous.
Now, the thing is, what I've noticed is a lot of, I mean, I can only talk about Pakistan because I've been here for the last 3 years. What I've seen is a trend within mothers that, they allow the kids to have the sweets, they allow them to have the milk, and literally you have the kids' teeth rotting. Why is that happening? Is that dangerous? And because a lot of the mothers say that they're going to fall out anyway and the new teeth are going to come. Is this thinking correct or incorrect?
And then do you think that the new ones are going to be in shape or not?
Yeah.
See, what happens is that in Pakistan, basically parents themselves are not much motivated about the oral hygiene.
Right.
So if the mother is not herself motivated, how can we expect her kids to be having a good oral hygiene or brushing habit? Now, when we talk about the toddlers or the bottle feeders, what happens is that if they are having the bottle in their mouth for a longer duration, or let's say during the night, they are having a constant exposure to bacteria and the milk is there, you have the sugar content, so you have to break the habit. and that you have to first counsel the mother that you have to break the habit, and there are many ways to break the habit. If the child is more prone to having a bottle feeding and he cannot sleep without a feeder, then you can replace the milk with simple water, so as to give the effect of having the pacifier or the nipple in their mouth, but they can be replaced. So with time they can correct the habit. Now the second thing is that when we talk about the preschools or the younger children, we have to make brushing a family habit actually. You see, the younger children, they are not going to directly go to their washrooms and start brushing their teeth. You have to tell them, you have to educate them. Plus, you have to make the brushing time an interesting habit, like we do the bedtime stories or anything. So we can do same with their brushing techniques. So we have to do that. Plus, another important thing is that when we talk about the kids, another important element is what toothpaste the mother are going to give to their young children. The normal toothpaste which we are recommending for adults, they are not at all recommended for the toddlers or the preschoolers. You have to go for the baby toothpaste, or there are many brands. I don't know if I'm allowed to take the names of them.
Yeah, go ahead. I mean, since we, you know,
Well, you
try
gave
to
us
make
some
people
toothpaste
aware.
last time, which I've been using, and it's great.
Yes, like the Protect ABC is there in the market. We recommend normally to all the preschoolers or the toddlers. They have the exact fluoride content that your child need during their pre-adolescent stage.
Right.
So you have to give them a perfect toothpaste along with a perfect toothbrush. Now, when we talk about the perfect toothbrush, it has to be, it is not related to the brand of the toothpaste. Like misconception is give your child or the adult a branded toothpaste. It's not about a branded toothpaste. It's about the quality or the bristle size or the head size of the toothpaste.
So what is that?
Normally that we recommend that you have to have a soft bristle toothpaste with a small head. The small head can
For the
easily
adolescents.
everywhere
yes.
else, yeah.
Oh, for the adolescents, for the kids.
For both.
For both, right?
Because
okay.
if you are going to use the medium or hard brush, you are going to have a vigorous brushing routine, you are going to damage your gingiva or the gum. So it is going to lead you towards sensitivity. So for younger children or for adult, the best toothbrush is a soft bristles plus a smaller head. Smaller head can approach to deeper areas and it can obviously clean all the things.
Okay, so whenever I've tried this, the soft bristles, I just feel like it's not working properly. So I was going for medium or hard.
Oh, it's all right.
What happens is that when you are using soft brush, there is automatically a feedback in your back of your
No,
mind
this is not what
that
you want.
because it is
You're
soft, so
scrubbing
you
it.
are going to have a softer effect.
Yeah.
Like if you are using a softer brush, you can use it vigorously or with force. It is not there to give you a soft or pleasant
Okay.
effect. It can give you the same effect that a hard or medium brush can give
Okay.
you. But it is not going to damage your gingiva ultimately.
Okay, we truly get that. But then at the
Interesting.
same time, for all those kids who actually ruin their, jaw structure just because of the fact that they have been sucking their thumbs and pacifiers for so long, so, the shape of their face changes. Are they supposed to come to you, all of those parents?
With patients having habits are supposed to go to an orthodontist.
No, but not the habits. Now, just because of the repercussion of the habit,
Yeah.
their jaw structure has changed totally. That's not how they used to look because they used to look cute earlier, right? So, probably the jaw expanded a bit or, it's not in the perfect shape. So, are they supposed to bring the child to you?
Initially, they are supposed to go to a general dentist,
Okay.
and the dentist is then supposed to refer the patient to an oral maxillofacial surgeon or to an orthodontist,
Okay.
because there are certain habit breaking appliances available,
Okay.
which
Okay,
can be provided to the patient during their habitual history or whatever.
Okay, so then what habits are those habits due to which you might even get an oral cancer?
Oral cancer. Okay. Oral cancer has several causes. It has environmental causes, it has genetic causes, and there are certain conditions which predispose the oral mucosa to oral cancer as well. First of all, the habits that are very dangerous: smoking, niswar or snuff dipping, right?
Snuff dipping kya?
Snuff dipping is niswar
Okay,
in
niswar.
some form, okay? And then gutka, pan, alcohol
Chalia.
intake, chalia intake. These are the leading cause of oral cancer formation or transformation in the oral cavity. Then there are certain conditions which predispose a certain individual to oral cancer. What we can say, there are scientific terms like patient who have oral submucous fibrosis or fibrosis in the oral mucosa. They are constantly eating this gutka, pan and chalia. and there is a constrictor which is developing in the mouth, and the mouth is no longer opening.
Okay.
So that condition is predisposing to oral cancer as well.
Okay, so then what are the symptoms of oral cancer as well? Just, if you can highlight them quickly.
The most important thing is that if you are having any kind of lesion within the oral cavity, in form of a ulcer, in form of a reddened area, white area.
But isn't everything red? So
Yeah,
It's pink.
It's pink.
It's pink. Okay.
just checking.
If there is constant redness,
Yeah.
if there is some fixation of the skin, if there is some constant swelling in the neck, then you have to go to an oral maxillofacial surgeon. If it persists for more than 2 weeks,
Okay.
you have to go get a biopsy done, because prevention is better than cure.
Yeah, stitch in time saves. Man.
Yes.
Yeah.
Okay, so Dr. Laiba, if you want to expand on this.
See, the basic thing is education. We need to educate our patients. And another important thing is the role of a general dentist in the diagnosis of an oral cancer. Because all the patients first report to general dentist for maybe cleaning of their teeth or filling of their cavities. So me being a general dentist first and being a surgeon later on, it's my responsibility, and Osama would like to, put emphasis more on it, that the general dentists need to recognize the role that they need to screen the patient while they are treating. Maybe they are doing fillings or they are doing scaling or whatever. If they see a little lesion, they need to tell and consult an oral maxillary surgeon for the proper protocol treatment done, because this is an initial stage and that can be treated better as compared to the later on developed lesions.
Okay.
Amazing.
Now, okay, so this is really wonderful and this has been so informative. But now, all of these things that we've spoken about, they're very costly, they're very expensive. So not everyone can afford it. And in the introduction, Shahzad did mention that there are people who cannot afford these procedures, so they resort to alternative methods. And that's, that's not safe, that's not healthy. Now, people who cannot afford to come to you, which is majority of Pakistan, I think, how can they look after themselves? Because at the end of the day, they are people too, and we need to give them information.
Exactly.
So if they need an implant or if they need to look after their hygiene, what should they do? I'll start with you, Dr. Laiba.
See, the first thing is very simple, very cost effective: brushing, mouthwash, floss. That is what you can do on regular basis. Trust me, most of your problems will be solved.
Okay.
And if you can quit on the habits of betel nut chewing or pan, chalia, things like that, and other habits of smoking and stuff, you can very well prevent chances of oral cancers.
Okay.
Yeah.
Excellent.
Yeah,
Okay,
that's the
now-
basic key thing,
Right.
oral hygiene maintenance.
Now, the thing is, how are we supposed to get this information out to the masses? I mean, Dr. Simon, you've been a dental surgeon for a while, and it's your field, it's your responsibility to make sure that people are healthy. How can we get this information that, just brush your teeth twice a day, floss twice a day? Once a day?
Once a day.
Once a day. And do mouthwash twice a day?
Yeah, maybe.
Okay, just checking.
But just don't waste
So,
it.
first, most important thing is getting into the masses.
Okay.
There are many dental camps, dental programs that are taking place on regular basis for
Okay.
these slum areas, or we can say underdeveloped areas.
Right.
There are many NGOs like the one I am working for, Smiles of Youth, that is going to all the underprivileged areas, and they are going to have a regular routine camps for the orphans or the lower middle class or the lower class children,
Great.
basically. So you have to reach the masses. Like if you at least educate one child, the one child is going back to his home and they are taking your message over there. So important thing is regular like camps. Second thing is mass screening. Basically screening is not taking place in Pakistan on regular basis. We being general dentists or being consultants, it is basically our duty, and ethically we are bound to get all the population under one screening, so that we can at least pick up the cases from the underdeveloped areas. So the screening is very important. Then after screening, we have to tell patients that if they cannot afford a private dentist, they can go to the government hospitals.
Then there are
at least.
medical camps too.
Exactly, they can go to medical camp. They can, all the medical government hospitals, they all have dental department over there, and they are giving free of cost treatment to all the patients. So patients are supposed to go over there, and in those areas they can get equal good treatment.
Amazing that
great.
is.
So there
Thank
is
you very
something
much,
else.
ladies, for coming over. Thank you very much for sharing your knowledge with
Thanks
us.
for having all of
and
us.
And now every
imparting our-
time-
Actually.
And every time we have a show on this, I feel like I need to go to the dentist. I feel like my teeth are going to fall out.
No, but they're not going to fall
No,
out.
I
don't
feel
worry.
like I've got a filling that needs to be fixed. So I'm going to consult the dentist after the show. But, Shahzad, you were going to say something.
Yeah, the only thing I'm going to say is that thank you very much for sharing information, and thank you very much for imparting it with all our other viewers out there as well. And people, I think it's your social responsibility to share what you know with all those other people who just don't have any idea about it.
Exactly, especially when if you see it, do it in a nice way. Don't be preachy about it because no one likes anyone who's preaching to them. So with that, do log onto our Facebook fan
Which
page,
is with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion and YouTube page.
World This Morning once again.
And the repeat is at
11 p.m.,
And
ladies and gentlemen.
we will see you bright and early very soon. Have a wonderful day.
Till the next time, 1, 2, 3.
Good morning.
Thank you very much.